So the first slide I have on the screen is an introduction into joints. So joints, another name for it is articulation. So when you hear someone says articulation, they're referring to joints. And joints or articulation is defined as functional junctions between bones. So where bones meet, we call it joint. And these joints have different functions they do for our body. Like I said earlier, joints allow bones to come together and form skeleton. Joints make bone growth possible. The joint permits several parts of the skeleton to change shape, as in during childbirth, when the mother's pubic symphysis joint slightly moves, make it easy for the baby to be delivered through the mother's from the mother's uterus into the vagina. That joint there has to move. The joint is called pubic symphysis. And joints enable body to move in response to skeletal muscle contraction. We're going to find out skeletal muscles, especially next week. They usually cross joint and attach to a bone on the other side across the bone where they originate from. So skeletal muscles usually cross a joint and attach to a bone away from the bone which they originate from. That's why when skeletal muscles contract, they pull on bone. They don't push on bone, they pull on bone. For example, my bicep crosses my elbow and attached to one of the bones of my forearm. So I want to contract my bicep as I'm flexing it. You're gonna see my forearm gonna keep moving towards my shoulder because this muscle pulls on the bone like this to enable body movement. Skeletal muscles contract because of joint to make movement possible. So in this very introductory slide, joints are functional junction between bones. Joints bind parts of the skeleton together. Joints make bone growth possible. Joints permit parts of the skeleton to change in shape. And joint enable body to move in response to skeletal muscle contraction. We can classify joints of our body into structure, or what they call structural joint types, or we can classify them into what they call functional joint types. The structural joint types can be separated into three different types: fibrous, cartilaginous, and synovial. While the functional joint types can be classified into what they call synanthrotic, amphianthrotic, and diarthrotic. If we focus on the structural classification of joints, this structural classification of joints tend to separate joints based on the type of connective tissue found at the joint. If the connective tissue is a fibrous membrane, that's a fibrous structural type of joint. If the connective tissue found at the joint is a cartilage, then that's a cartilaginous structural type of joint. If the connective tissue found at the joint is a synovial membrane, then that's a synovial structural type of joint. Now, based on the type of connective tissue you find at that joint, the joint can be movable, or the joint can be slight movable, or the joint can be freely movable. If that joint moves freely, then that joint type is obviously a synovial, because synovial functionally they move freely. If a joint slightly moves, allows slight movement, then most joints that allow slight movement are usually cartilaginous. And then if the joint rarely moves at all, most joints that rarely move are usually fibrous type of joints. So joints can be classified based on the type of connective tissue found at the joint or based on the degree of movement allowed by the joint. So if a joint is freely movable, that's a diatratic functional type of joint. If a joint is slightly movable, that's an amphitratic functional type of joint. If a joint rarely moves at all, and that's a synanthrotic functional type of joint. So these are two ways we classify joints in our body. They are structural or functional. Under structural, we have three examples. Under functional, we have three examples. Any question?
When you say it is a fibrous joint, what do you mean? Fibrous.
It mean the type of connective tissue. Remember in chapter 5, we said there are four types of connective tissue.
Okay.
And the connective tissue that we call fibrous, those ones have a lot of fibers. So fibrous fiber. You got it? So those connective tissues are tough connective tissues. Um, those examples of those ones, we're going to talk about them. The they are like your your suture. You see where the cranial bones come together? The
Mm-hmm.
joint that holds them is an example of fibrous connective tissue. Um, our tooth is attached to the upper jawbone or lower jawbone, and the type of connective tissue that allows them to anchor is a fibrous type of uh, uh, connective tissue.
Okay.
So, so, so as we go further in, I'm going to give you little examples on this that is associated with each of these types of structural and each of the types of functional. But this is a very good way of classifying the joint types based on the connective tissue they have
Mm-hmm.
or based on the degree of movement they allow. If they allow, if they are looking at them in terms of movement, then we'll look at functional. If you're looking at them in terms of the type of structure they have there, then we're talking about structure. You got it, Janet?
Yes.
Okay. So let's look at the fibers. So here's a slide showing us figure 8.1. It's titled fibrous joints. So fibrous joints, they are usually seen in dense connective tissues that have a lot of collagen fibers. They are seen in connective tissues that are dense because they have a lot of collagen fibers. And these joint type are found in bones are in close contact. For example, the diagram they have there on the screen is showing us two bones of our leg. Remember, the leg bones are tibia and fibula. So if you look at the diagram, you're going to see the tissue between tibia on the right of the screen and fibula on the left. That tissue is called interosseous membrane. It's there to hold the two bones firmly. So that's an example of fibrous type of joint called syndesmosis. We call this type syndesmosis. This type also exists in our forearm between our radius bone and our ulnar bone. Okay, they are examples of what we call syndesmosis. And then another example of fibrous joint is the joint type that holds the skull bones for us, that holds the bones of the skull for us in close contact. That type we call it suture. So you see here suture between flat bones of skull. You can see how the suture looks like. They look like zigzag. You see that? So sutures are also examples of fibrous joints. They are found among bones of our cranium or skull, with the exception of the one called mandible. And then we have another example of fibrous called gum fosses. See the diagram of a tooth, and you can see that tooth is anchored to a jawbone, and the connective tissues, which are periodontal ligament that holds them close, that holds the jaw bone and the tooth together, they help make up what we call gum fosses. So the gum fosses is another example of fibrous joint that allows tooth to anchor to our jaw, to the jaw of the mouth, either the upper jaw or the lower jaw, while the suture allows bones of the cranium or skull to fuse together, while the syndesmosis is found between bones of the forearm or bones of the leg. So these are three good examples of fibrous structural type of joint. Another structural type of joint is the one called cartilaginous. A cartilaginous, the name tells you what kind of connective tissue is found at the joint. It has to be a cartilage. That's why they call it cartilaginous. So which means in this joint type, there has to be a cartilage present. And this cartilage are usually hyaline cartilage or fibrocartilage that exist between the bones found at the joint. And examples of cartilaginous joints type in our body are like synchondrosis and symphysis. Now the synchondrosis, examples of this in our body are like the first rib bone, or the second rib bone, the first rib bone. That bone is immovable. It's firmly attached to the cartilage that attached to the sternum part called manubrium. So our first rib bone articulation with the sternum by way of costal cartilage is an example of synchondrosis. Another example of synchondrosis is the epiphysis plate of cartilage that we call the growth plate. Okay? Because over time, that growth plate is replaced by bone tissue, okay, that makes the bone mature. So epiphysis plate of cartilage over time converts to what they call synostosis. It converts to what they call syntosis, which is ossification when the bone becomes mature. What am I saying? I'm saying that two good examples of synchondrosis that has to do with hyaline cartilage present at the joint. One is the growth plate, or what they call epiphysis plate of cartilage that later turns into bone tissue. And then the second one example of synchondrosis is where your first rib bone articulates with the sternum bone of your rib cage. So those are two good examples of synchondrosis. Another example of cartilaginous joint is the one called symphysis. So symphysis is found in the pubic region of the body where they form what they call pubic symphysis, where two pubic bones come together, as in diagram A. So the diagram A is showing us where the two pubic bones of the pelvic, they unite in front area of the pelvis to form what we call pubic symphysis. This is an example of symphysis type of cartilaginous joint. And then we have the intervertebral disc that is shown in diagram B, that is colored white. That's a disc between your vertebral bones. Those are also examples of symphysis. So the difference between the symphysis and synchondrosis is that the symphysis use fibrocartilage, while the synchondrosis uses hyaline cartilage. Or they are both examples of cartilaginous structural type of joint. Any question? Any question?
So what is a pubic symphysis?
So you know where the part of the body they call, okay. Um
Hmm.
you know where they call, where we have our pubic hair?
Pubic hair?
Yeah.
No, that's why I asked her. I
So
don't
you
know.
remember our private area. Okay.
Okay.
There's pubic hair there. Both males and females have that.
Okay, that's the
So
ear and
so
mhm,
the name pubic comes from one of the three bones found in that area. So remember when we talk about the hip bone, we
mhm,
mentioned that one is called pubic,
mhm.
another one is called ischium,
And
another one is
female.
called ilium.
Yes.
Now, the left pubic bone, the left pubis bone, or I'll say pubic bone, the left pubic bone and the right pubic bone, where they usually meet in front of the pelvis. Now, what allows them to come together is a cartilage. That cartilage is a fibrocartilage. So you look at the diagram A on the screen. You see that on the screen?
Mhm.
So you
Yes.
see the left
Yes.
pubis and the right pubis, they are held together by this cartilage in the middle. That cartilage is a fibrocartilage. So that's what they call pubic symphysis. Yeah, it's an example of a type of joint.
Um,
And this joint type slightly moves when a mother is about to give birth to a baby. It can move slightly to make it easy for the baby to slide
it
out.
was that, right.
Yeah. So that's what they call pubic symphysis.
I
So it's a
said
type
no.
of cartilaginous joint.
Okay.
Okay. All right. So we out of a structural type of joints, we talk about fibrous, we talked about cartilaginous. The third one we need to talk about are the ones called synovial. So synovial, yeah. So synovial, look at what they're telling us about it. Most joints in our body are synovial. You see, I'm doing my head like this, synovial. You see, I'm doing my elbow like this, synovial.
Synovial.
See, I'm doing my wrist like this, synovial. You see, I'm doing my
Synovial.
fingers like this, synovial. Because
Synovial.
these joint
Okay.
types, they allow us to perform free movements, no restriction.
Mm. Okay.
Okay. So they are all said to be what they call diatrotic.
Yes.
They are said to be all diatrotic. Now, the bones that you find in a synovial joints, okay, that area usually consists of two layers. An outer layer that is rich in fibrous materials such as ligaments, and an inner layer that has synovial membrane that secretes a fluid called synovial fluid. And that fluid lubricates the joints. It prevents the joint from wearing out. As long as that fluid is secreted into the synovial joint, it prevents our freely movable joint from wearing out. Okay. All right. Here's a diagram showing us synovial joints. So this is a general structure of synovial joint. On the top part, you see a bone. At the bottom part, you see a bone. On the outside, you see the fibrous tissue. On the inside, you see a synovial membrane. It's colored blue. And then the space separating the upper bone and the lower bone, that's called joint cavity. That's this cavity where the fluid that keep our joints lubricated are usually secreted into. And then you see the surfaces of the bone, the upper bone and the lower bone. There's a whitish material there. That's a cartilage that protects the bones from touching each other and keeps that area viable and alive. Here's a lateral view of the knee joint showing us three bones at the knee. The bone in front is called patella. The bone on the top is femur. The bone at the bottom is tibia.
Tibia.
And the space between all three bones is the joint cavity that has a fluid called synovial fluid that allows the joint to be freely movable for us. Now, the synovial joints, they come in six types. Six types. Among the six types of synovial joints, we have the ones called ball and socket. The reason why they use the name ball and socket is that the bone that is found at this joint, the head of the bone is kind of round and it fits into an opening inside another bone. That's why we call it ball and socket. And this type of joint can be found on our shoulder as well as our hip. You can see diagram A is showing us ball and socket joint where the head of a femur articulates with an area on the side of a pelvic bone called acetabulum. That's what they call ball and socket. Even our arm bone, the head is round. It also articulates in a space or opening or cavity inside our scapula called glenoid cavity. So your shoulder joint and your hip joint are examples of ball and socket, which is also an example of synovial joint. Another example of synovial joint is called condylar joint. This joint type is found between bones of a finger and bones of a hand, as in between your phallus and your metacarpus. You can see the diagram B is showing us location of a condylar joint. So this joint type allows us to perform front and back movement side to side, okay, but no rotation. But one difference between this joint type and ball and socket, ball and socket allows us to perform a range of motion. We can rotate, you can circumduct, you can flex, abduct with ball and socket. Another example of synovial joint is the one called plane joint. So these plane joints are found between our, our carpal bones. So the carpal bones, there are 8 of them. The joint type that exists between them is called plane joint. This joint allows us to twist, okay, and then move our wrist forward and backward, okay. Um, so that's what they call plane joint. We can also find that in our ankle area called tarsal. The bones here can also uh, twist or move forward and back, forth and back, okay, because the wrist and ankle bones, they are held together by plane joint or what they call gliding joint. And then we have a fourth type of joint of synovia called hinge joint. The hinge joint can be found in our elbow, allowing us to flex our elbow or bend the elbow and extend the elbow because of hinge joint. The hinge joint allows for one directional movement, back, forth, back, forth. The same with the bones of a finger. Okay, bones of the fingers, they have hinge joint, so I can do this. What's that? What's that? I can do that. So hinge joint exists between the 3 bones of our fingers. Each 3 bones of the fingers, each finger bone, the 3 bones in them has what they call hinge joint. That allows us to bend the finger like this. See that? Because of hinge joint. So let's look at diagram D. It's showing us hinge joint of the elbow between the ulnar bone and the distal part of your humerus. The fifth type of synovial joint is the one called pivot joint. I'm able to do this class, we're able to rotate our head side to side because of pivot joint. The pivot joint is found between our first cervical vertebrae and our second cervical vertebrae. They allow us to rotate our head as in no. You see that? They only allow for rotation. And then the sixth and last type of synovial joint is called saddle joint. This joint type exists between bones of a thumb and bones of the carpal. Okay, so between your metacarpal and your carpal bone, you find saddle joint. So these are the 6 types of joints that make up synovial joint. And then when we looked at cartilaginous joints, we saw 2 types of joints in there, which are symphysis and synchondrosis. And then when we look at fibrous type of joint, we're able to look at suture, syndesmosis, and what we call gomphosis. So far, we've talked about the joint types in our body. Now, here are types of movement made possible by the synovial joints. Now, contraction of skeletal muscles in our body, they produce movement at synovial joints. And the part of a muscle that is fixed, that doesn't move at all, even though there's a movement at the joint, we call that part of a skeletal muscle the origin. While the part of a skeletal muscle that usually moves to make the movement possible, we call that part insertion. So for example, class, this is my bicep, this right here. The bicep originates from my shoulder, and then it crosses my elbow and attached to one of the bones of my forearm. So if I want to flex my bicep and make this muscle contract, guess what? As I do that, look at what is going to happen to my forearm. My forearm going to move towards my shoulder because this muscle pulls on the insertion end like this to make the muscle contract. So when muscle contracts, they pull on bone to make movement possible. Muscles do not push on bone. They pull on bones to make movement possible. And the muscle which I'm talking about are skeletal muscles. Here are types of body movements made possible by skeletal muscle and the synovial joints. We have movements that we call abduction. We have movement that we call adduction. So if you look at the image on the screen here, A is showing that when you move your leg away from the middle to the side, that's like abduction, means away. When you bring it back to the middle, that's adduction, toward. So adduction means toward the middle. Abduction, like abduction, to take away, means away from the middle.
Okay. Can I ask a question? We're
Question.
talking about muscle contract.
What's the
So when
question?
uh, okay, I'm talking about the muscle contract. So when you have the muscle contract, because I have it too, and sometimes I have to, if I lay down, I have to get up, put my feet on the floor before it could disappear. What caused muscle contract?
We're gonna leave muscle contraction for next week because that's a muscle chapter. So for
Okay.
this chapter, we're dealing with joints, okay, and movement. So let's leave that for next week, Janet, okay? So
All right.
next week is all about muscles.
Okay.
Okay, so there we're going to talk about what causes muscle contraction. We're going to talk about how your nerve must release a chemical called neurotransmitter before your muscle contract.
Okay.
If your nerve doesn't do that, your muscle won't contract at all. So we're going to be talking about something called neuromuscular junction. So
Okay.
next week is all about muscles. Okay, but for now, we're just talking about the
Boom.
joints. Okay,
Joint.
all right, and the type of movement associated with the joints. Okay. And these movements are made possible in conjunction with your bone and your skeletal muscle. All right. So another type of joint movement is called flexion. Flexion means bending. And then another type is called extension. Extension is like to straighten. So you can see flexion of a lateral part of the body. They call that lateral flexion, which that person is demonstrating in B. And then you can see C that's showing us flexion at the knee. And then E is showing us extension at the knee. So opposite of flexion is extension, just like opposite of adduction is abduction. And then we can flex our arm by raising it up. And then we can extend it by bringing it downward and pushing it towards away from and bringing it downward. So that's called extension of the arm. Why? If I raise it up, it's called flexion of the arm. So flexion of the arm and extension of the arm is different from flexion of the forearm. So flexion of the forearm, I'm doing this. Extension of the forearm, I'm doing this. So forearm is different from arm. Another type of joint movement is dorsiflexion and plantar flexion. These type of joint movements are movements made possible by the foot. So dorsiflexion and plantar flexion are foot movements. So you can see them in image in A. If you bring your foot down, it's called plantar flexion. If you raise your foot up, it's called dorsiflexion. And then another type of joint movement is called circumduction, opposite, and rotation. So most of us, before we took this class, we think when someone does this, it's called rotation. Or go like, if I do like say rotation, no, that's not rotation. Rotation means I show you this side and I show you this side. It's called rotation. But if I go around, we call that circumduction. So when you go around an axis, we call it circumduction. If you show one side and then show the opposite, show the other side, that's called rotation. Just like I show you my palm and then show you the back of my hand, that's rotation. So two hand movement made possible by rotation, you can see that in D. We call those supination. I'm showing your palm, and then I show you my back of my hand. It's called pronation. Pronation, supination. You see that? So this is supination and pronation. They are hand movements made possible by rotation.
Right.
Okay. And then we also on the screen, you can see medial rotation. If I do this, it's called medial rotation. I'm showing the back of this area. And then when I do this, it's called lateral rotation. I'm showing you this area. See that? So side to side is called rotation. But when you go around, we call that circumduction.
Oh.
So dorsiflexion are foot movement, just like plantar flexion is a foot movement, while supination and pronation are hand movement made possible by rotation. And then we have another movement types. You can see inversion and eversion. The inversion is when you show your soles of your foot medially. You expose the medial aspect of the sole of your foot. That's called inversion. But if you expose the lateral side of your soles of your foot, we call that eversion. And then I can move my neck forward, my jaw like this. We call that protraction. Can pull that back. It's called retraction. Protraction, retraction. I can raise my shoulders up. It's called elevation. If I bring my shoulders down, it's called depression. So these are types of body movements made possible by the joint type called synovial. So synovial joint movements are what we just saw, and they are made possible in conjunction with our skeletal muscles working with the bones of the body. Now, that's why next week, when we talk about muscles, we're going to talk about the muscles that allows us to elevate, the muscles that allows us to perform inversion, the muscles that allows us to flex, extend. All those we're going to talk about then next week when we're going to be talking about muscular system. And the muscles we're going to be talking about that makes this movement possible going to be the muscles called skeletal muscles. Any question? Nicole Summers, you have a question?
No, I did not.
I just want to check if Nicole is here. Okay. Let me see. Oh boy. That's just
Everything is basically self-explanatory.
it
The
is.
picture.
Thank you. Uh just class, give me a minute. Okay. Okay. So next we need to look at special type of synovial joints. So here is one. So when they talk about a special type of synovial joints, they are talking about the large, complex synovial joints of the body. And these ones are found in the shoulder and the hip, where we have ball and socket. And we have the elbow, where we have the hinge joint and also the plane joint too. And then the knee. Okay. So let's start with the one called shoulders. So here's a slide showing us figure 8.138. It's reminding us again that the shoulder joint, just like the hip joint, are examples of synovial joint called ball and socket. But since we're talking about the shoulder, the two bones involved here are our scapula and our humerus bone. You can see the diagram A showing us the head of the humerus. Inside the joint cavity, in the glenoid cavity of the scapula. So that's glenoid cavity of the scapula has this space inside of it that allows the head of the humerus to articulate. And they are not really tight, but there's a space between them that allows for movement. That's why ball and socket is an example of a freely movable joint that we call diatritic. And you can see that this joint type allows for very wide range of motions of movement, including rotation and circumduction. In addition to that, there are ligaments, okay, in place to prevent the bones at this joint from being displaced. And then we have bosses that secrete the fluid that keeps these joints lubricated. Here's another slide showing us a real image of a cadaver showing us the humerus bone and the cavity called glenoid cavity of the scapula. You can see this is a real image class. I can see the muscle, the tissues such as the cartilage. I can see the head of the humerus. You can see the joint capsules of the shoulder joint. While the other two diagrams are showing us the type of ligaments that are in place to make sure that this joint doesn't get displaced. And among these ligaments, the major ones are coraco ligament, or what they call coracohumeral ligament, and then we have the glenoid humeral ligaments, and then we have a transverse humeral ligaments. I can see the glenoid fossa where the head of the humerus usually articulates in diagram B. You see that? So class, that's what we call a shoulder joint. Okay. And then another joint type is the elbow joint. So the elbow joint contains two articulations. One of the articulation is the hinge joint between the distal end of the humerus and the proximal part of the ulnar bone. Okay. And those two forms the hinge joint. Okay. And this hinge joint allows for flexion and extension only, so I can flex, I can extend, I can flex, I can extend because of the hinge joint at the elbow. While the plain joint at this elbow is between the radius and the the capitulum of the humerus. Where they meet, they form a plain joint class. And this plain joint allows me to do this. Supination, pronation. Supination, you see when you do supination or doing this, there has to be a movement at the elbow. And when you do pronation, there also have to be a movement at the elbow. So those movements are made possible by the plain joint between the radius and the distal end of the humerus. And then in this area, you're going to see there are several ligaments that are in place to help reinforce this movement. So here is a diagram A showing us the ligaments. They're colored in white. Diagram B showing us the ligaments. And the major ligaments that makes this possible are like radial collateral ligament, ulnar collateral ligament, and annular ligaments. Another joint type that is complex is the hip joint. The hip joint is the same as the shoulder joint because they are both ball and socket. You can see the diagram showing us the head of the femur is round. And this round head fits into a depression on the side of the pelvic bone called acetabulum. And to ensure that this insertion of the head of the femurus of the femur, the insertion of the head of the femur is firmly intact, there are ligaments that connects from the pelvic bone to the femur, from the femur to the pelvic bone, and wrap around that area to make sure to reinforce the firmness of this joint. Okay? And there's so much in that the variety of movement made possible by the ball and socket joint of the hip is less when compared to the one of the shoulder. I can do a lot with my shoulder, I can do this, do that, but there's only that much I can do with my hip because of this reinforcement made possible by the ligaments, making sure that the pelvic and the femur are well anchored. And this slide is showing us on one side to the left is showing us a real image of a femur. You can see the joint separating the femur from the hip bone. On the surface of the femur, that round surface of the femur head, you can see the articular cartilage there. You can also see articular cartilage on the surface of the hip bone area where the head of the femur articulates. The other side of the screen, you can see the diagram showing us the ligaments. Some of the ligaments anchor the femur to the part of the bone of the pelvic called ilium. I can see another ligament anchoring the femur bone to the other part of the pelvic bone called pubis. And on the back here, in the other diagram, you can see another part where a ligament anchors the femur to another bone or the third bone of the pelvic called ischium. So all these ligaments that help reinforce the anchoring of the femur to the hip bone, they are iliofemoral ligament, which is said to be the strongest of them. As a matter of fact, it's said to be the strongest ligament in body. And then we have the pubofemoral ligament, and then we have the ischiofemoral ligament. So based on the name, you can tell where the ligament is coming from and where it's going to. It's going from ischium to femur, then we call that ischiofemoral. If it's going from pubis to femur, we call that pubofemoral. If it's going from ilium to femur, we call that iliofemoral. So these are the three major ligaments that helps reinforce the hip joint for us. Any question? Is there any question?
No questions, Professor.
All right. So next, we're going to look at another we're going to look at a clinical application in relation to hip replacement. So here's a slide showing us titled Replacing Joints. So when joints are damaged, uh, most of the time we use synthetic materials to replace the joint damaged by either arthritis or injury. And in large joints, we use steel and titanium. In smaller joints, we use silicone. And in some smaller joints, they use ceramic. And hip replacements are the most common uh, joint replacement. Okay, especially as we tend to get older, most of us gonna succumb to hip replacement. Now, newer technology for joint replacement tend to use materials that resembles our own natural body chemicals, such as coating implants with what we call hydrosul apatite. Does anyone remember what hydrosul apatite means or what it stands for? When we did bone, I mentioned hydrosul apatite as another name for something. So when calcium gets stored in our bone, they are stored as calcium phosphate. So another name for calcium phosphate is hydrosul apatite. So that's what they meant by coating implants with calcium phosphate, which is similar to our own body natural chemicals. And then 3D printing technology has been shown or is being used to create custom replacement joints. Next is a knee joint. So knee joints, they are said to be the largest and most complex joint in the body. At the knee, we have three bones there. One bone that sits at the knee is patella. This bone is more anterior to the knee. And then another bone whose distal end can be found at the knee is femur. And then we have another bone whose proximal end can be found at the knee, and that bone is tibia. So these three bones, they are all strengthened by many ligaments and tendons found at the knee, and they're also cushioned by bursae and what we call fat pads. And in this very knee joint, we can find connective tissues that we call menisci, especially between our femur and tibia bone. Here is a slide showing us figure 8.21. This slide is showing us knee joint. In this very slide, you can see major ligaments of the knee, such as the patellar ligament, oblique popliteal ligament, arcuate popliteal ligament, tibia collateral ligament, or what we call MCL, medial collateral ligament. You heard of someone say, oh, he or she torn their MCL. Or he or she torn their LCL. That's called lateral collateral ligament. Or they tore their ACL as an anterior cruciate ligament. Or they tore their PCL as a posterior cruciate ligament. And if you look at the diagrams on this screen, you can see how these ligaments, they all are said to be unwind, circulating, all to make sure that the bones of the at the knee are well firmly in place while allowing for some kind of flexibility or movement. So the benefit of these ligaments at the knee is that is that uh, they help make flexion and extension possible, and they help make some rotation when knee is flexed possible, and they also make playing joint between femur and patella possible also. So your knee joint is a modified type of hinge joint between the condyles and the knee. So the condyles are the articular cartilages that you find at the knee that is colored white. Any question? Is there any question? Celia Rodriguez, do you have a question? Francesca Codo, do you have a question?
No, Professor.
Laquia Ropa, do you have a question?
No, Professor, I'm good.
Latasha Craig. She's on hold. How would someone be on hold? All right. Now, the last part of this very chapter has to do with clinical applications. Now, in terms of clinical application, we're talking about the joint disorders that affect our knee. They include terms such as sprains, bursitis, and arthritis. When it comes to sprains has to do with tearing of the connective tissue called ligaments in joint without bone dislocation. Now, if the tendon that attaches muscle to bone is what is torn, then we call that strain, as in strain. But if the ligament is what is torn, we call that sprain. And then we have what they call bursitis, which is inflammation of a bursa from overuse or stress. The bursa is a sac that secretes the fluid called synovium that helps lubricate the knee or the joints for us. So when this sac is inflamed, we call the condition bursitis. It's usually due to overuse of the particular region of the knee, or it could be due to stress, which that knee is suffering from. And then we have arthritis. The term arthritis has to do with inflammation, swelling, and pain in a joint. And arthritis comes in three unique types. We have the rheumatoid arthritis. Arthritis of this type has to do with the person's immune system attacking tissues at the person's joint. And when this happens, we call it rheumatoid arthritis. And the fact that it's the immune system attacking the joint, this is an example of what they call autoimmune disease. Normally, your immune system shouldn't attack structures that belong to your body. But if your immune system are making antibodies that are attacking structures that belongs to you, then that's an example of an autoimmune disease or autoimmune condition. And in this case, since the immune system are making antibodies attacking the joint, we call this rheumatoid arthritis. Another arthritis is an arthritis that usually happens as we get older. This arthritis type is called osteoarthritis. It's also known as degenerative disease or wear and tear arthritis. It's the most common type that occurs as we age. It's usually attributed to the fact that we are not doing enough exercise or we're not being active. So if you're not an active person, you don't do exercise at all, you're making yourself vulnerable to osteoarthritis. And then we have Lyme disease, caused by tick bite. And the tick that bites us and causes Lyme disease, they're usually carried by deers. Okay? And then as deers carries them, they usually leaves them uh, on the grass, okay, on the lawn, and when people go to play, and sometimes the tick gets in and bites them and stays there very strong. You have to see a doctor for a doctor to remove that from your skin. Okay. And when they leave the bacteria in your system that goes to your joint, this bacteria is Lyme arthritis. And this Lyme arthritis have stages. If not treated properly, the third stage usually affects the nervous system. Any question about the joint disorders? Clara Joseph, you have a question?
No, Professor. Thank you.
Okay. All right. Finally, the question is, as we get older, what happens to our joints?
Yes, that's the question I was just asking you. What
Okay.
about if we eat the right
They start
food?
getting weak, right?
It's got getting weak as we get older. It start getting stiff and weak. It start getting stiff. It's stiff as we get older and we start feeling pain. Oh my God! I mean, you know when
Yeah.
you want to go down like out, yeah, some noise. Oh my God!
I'm not
My knee.
old and I still feel that now. No.
Oh
I would say
gosh.
the same thing.
Now, if you feel that right now,
And
it's because probably you're not being active. You're not
and
active
what about
enough.
Yes, you're
and
right.
yes,
I need exercise.
yes.
So
And
either
even what
you do,
about you eating right
eating
the right
eating eating right helps. The eating one helps in terms of our weight. So
what
if we
is
eat the right weight, if we eat the
but
right
this
food, it prevents us from picking up unnecessary weight. Because think about it, if we pick up unnecessary weight, we put in a lot of pressure on our joints, especially the knee joint.
right.
So, but if we lost some weight, it helps relieve that weight from the knee joint, even the hip joint. It helps relieve that because so that's why, uh, based on our height, okay, we need to find out what weight is comfortable for us. You know, a certain weight one can find themselves based on their diet, okay, their way of eating and their exercise, and they just feel enormous energy because of that weight, that type of weight they have. And then there's some kind of weight we're gonna put up that's not the right weight for that height which we have. And then we're gonna find ourselves just tired most of the time, sluggish most of the time.
Can't even
That's
go up
why,
the subway step. Can't even go up the subway step.
oh,
Your
that one is not good.
joints.
That one is not good.
Oh gosh.
That one is not good.
In your joints, it's coming like you're gonna pass out.
But the best way to keep that is to be active and then make sure you're eating the right food. And find a weight that works well for you. You don't have to be like the next person, but just find a weight that works best for you. A weight in which you feel energized, you feel vibrant. Oh my God. Not no. So let's look at what happened with lifespan changes. So one lifespan changes that happens as we get older with relation to the joint is what they call joint stiffness. You see that? They say it's an early sign of aging. Some of us are young, but we're aging quickly. And many people develop arthritis as they age.
Mm-hmm.
Okay, because as we get older, most of us become we don't get as active as we used to be when we were younger, probably because of our job or things get ourselves caught up. We don't have time. Wake up, boom, you're at work or work, you're home, take care of the kids. We don't really have time for ourselves. So, because we don't really have time for ourselves to be active, do exercise for ourselves, many of
Right.
us going to develop arthritis as we age. Okay, and the fibrous joint types, which are the ones, okay, which we said are like cartilaginous that has cartilage, or or no, not the cartilaginous one, the one that anchors our tooth to our jaw, that's a fibrous joint. Uh, the ones um, that
Uh,
is found between bones of the forearm and bones of the leg that we call syndesmosis, and the ones that help articulate our cranium, our facial scores for us, those ones gonna first start experiencing change, okay, and they can strengthen over uh, over a lifetime, okay. Um, but the cartilage ones, okay, like the synovial ones, those ones have cartilage, as well as the the ones we call cartilaginous joint, those ones have cartilage. Those ones, those cartilages, especially the one, um, the ones we call synchondrosis, they're gonna start stiffening. As they stiffen, the ligaments at the joint gonna lose the ability to stretch or to be elastic. So that's why they say ligaments lose elasticity as we get older. Uh, there's changes in symphysis joints of our vertebral column that we call intervertebral disc. They're going to diminish in terms of their flexibility. And as they diminish in terms of their flexibility, they tend to decrease our height as we get older because the intervertebral disc shrinks, cutting our height little by little because the intervertebral discs tend to lose water as we get older.
I was just gonna ask you what happens to the synovial fluid that we have between our knee?
It
Does
dries
that
up.
start going away? It
It
dries out?
dries up, right? That's
That's
why I
why
see.
okay.
That's why I see that some people they go for it. They inject
A
some type
knee
of gel
replacement and
there,
stuff.
right? Or some people go for replacement. Some people go for gel. They intend to inject the gel in there for them. So they do that every 3 months or every 2 months, forever. Or go for knee replacement. Yeah.
What age
But
what
but
age
what age? It can happen any age. So this is so,
I just want to know if that's what
Janet, it
happened to me.
happens to me. I had a knee surgery. I had a knee
Really?
surgery when I was 25. I'm 33, and they
so
told
that's
me
what
in
I'm
the
saying. It can happen in
future.
any age. Go.
Oh
Yes.
wow.
It can happen in any age. Okay. But especially as we get older. Okay. But look at this. Look at this. What they're telling us on the screen. The
Mm-hmm.
synovial joint. They lose function
Function.
as capillary supply diminishes. Capillary supply
Mm-hmm.
meaning blood supply to that area diminishes as we get older. So they start losing function. But the biggest problem, you see what they talk there, what they're saying there? Disuse.
I'm heard.
Disuse. You know what disuse means?
No.
Not being active, not doing exercise. Okay. They say disuse hampers the nutrient supply to joints. So whenever we do exercise, we 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 flex and extend the joint areas. Guess what? Whenever you extend it, the fluid is sitting at the joint between the bones. But when you flex it, the cartilage on the surface of the bones that will act like a sponge. You know how a sponge acts to pick up the fluid? So they pick up the fluid, and that fluid have nutrients that keep the cartilage cells and the cartilage alive. But when we don't do that, the cartilage cells, they're not getting the nutrient. So what's going to happen to them over time? They're going to stiffen and then they're going to die. And then when they die, they wear off. And then bones start touching each other. That's what they call osteoarthritis. Wear and tear
Professor,
arthritis. Question.
can you have arthritis at a young age, like at 23?
It depends on the type of arthritis you're talking about. So remember, we talked about 3 different types of arthritis.
Mm-hmm.
It could be rheumatoid, it could be Lyme disease, or it could be osteoarthritis. So one can have rheumatoid at a younger age if the immune system is attacking the joint. One can have Lyme disease or Lyme arthritis if they are bitten by tick that causes Lyme. But when it comes to the osteoarthritis, that one has to do with aging. The osteoarthritis one has to do with aging. So the osteoarthritis one is the one that we tend to succumb to as we get older. And the reason for that is because of disuse, not being active, not doing exercise. And when we're not active, we're not exercising, we are hampering the nutrient supply to the joint that provide nutrients for the cartilages located at the joint. And if the cartilages are not getting nutrient because we're not exercising and we're not active, then guess what? They're going to start dying and that area going to stiffen. They're going to become stiff. The cartilage is going to stiff. And when they become stiff, they start wearing off. And before you know it, bone and bone going to be touching each other. That's why the last sentence on this very slide says, activity and exercise can do what, class? Keep
Keep joints function
stronger
longer.
longer. You don't have to be like an athlete. You can find yourself walk with your friends to the park, walk from block to block. Okay, no, you can do that every day. If you drive a car, you can park here, park 3 blocks away from where you walk. Okay, and then when you walk down, all those are exercise. Okay, you sit, you stand, you sit, you stand. You're
And
helping
squat.
yourself. Okay.
Yeah, sometimes I do that. I feel the bone. I heard the bone like.
Oh, okay. It means it means you're close to the up. You're getting up.
Come on. Don't even go there. I hear the bone go crook. I said, oh my God, I'm not exercising.
But it's gradual, though. Gradual. Okay. All right. That concludes this chapter 8 class. So let's take a break. When we come back, we're gonna start our labs, and then we're gonna any other question you guys have for me, I'm gonna be able to entertain that. So right now the time is 7:23. Let's resume at 7:45 or 7:50. Okay.
750, right?
Okay.
7:50. Okay. All
Yeah.
right.
Okay.
All right. I'll see you guys soon. Okay.
Okay.